Hello, everyone, and welcome to our podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Farida Golombieski, nurse practitioner here at RevitalyzeMD, and today we are talking about urinary incontinence.
And Vtone, which is one of our new services that is just the Cadillac of services for treating urinary incontinence.
So. Absolutely. We are really excited, like we always are, for all of our new devices. This one especially because it is FDA approved.
That's right.
To help the pelvic floor muscles and to help with urinary incontinence. So a lot of our women struggle with that. So we have a treatment now that we can use in addition to some of our other treatments or as a monotherapy.
Yes, absolutely. So we do have a lot of treatments that actually will treat urinary incontinence, and along with that goes, or decreased orgasmic strength, laxity, decreased lubrication. So all of those things can happen with perimenopause or menopause or just childbirth and changes in the tissue down there. So we do a lot of regenerative treatments that target just that area for improvement.
Yeah. So as we age, that tissue changes. It can change from hormonal changes and deficiencies. It can change with pregnancies, childbirth, menopause.
So basically, if you look at the vaginal canal, from the side, the urethra sits right on top of it. And so just all the weight of pregnancy obliterates the space in between the anterior vaginal wall and the urethra. And that space is what supports the urethra, but it also houses the G-spot, which technically isn't a spot. It's really a complex. So it involves the urethra, the clitoris, and the vaginal canal. Absolutely. And so we're regenerating that with multiple procedures, which we're going to go into. And again, a lot of those are targeted just to the anterior wall, that space. And Vtone is targeted to the pelvic muscles, and it stimulates them beyond what we can do with Kegels, which is known to not work, because if they did work, and we're always recommended to do them, we would not have any urinary incontinence that continues, right?
Exactly. We wouldn't have women in here saying, hey, I cough, sneeze, jump.
Yes. Wow. And this is
carry something and I have an issue. What's going on? And Kegels are not making a difference. So obviously anything to help with pelvic floor. So Kegels will help. Don't not do Kegels. Definitely do your Kegels.
Oh, yeah.
Yoga. There are definitely exercises that target that. But this is electrical muscle stimulation, EMS, that actually targets those muscles and works them to strengthen them. So it helps with pelvic floor dysfunction, which is very cool.
Yeah. And if we think about it historically over the years, they have recommended Kegels right after, you give you have birth the first time. Vaginal delivery, they're recommending that you go into the doctor, primary doctor, GYN doctor with some urinary incontinence complaints. And that's the first thing. More severe doesn't respond to Kegels. What is the next step is either medications or surgery. And again, I think anytime you cut on tissue, you affect blood flow and function. And so you want to do something that isn't cutting. So what are some of the things that have been recommended?
Yeah. So when we
eye-opening for us, for sure.
Exactly. When we were looking at our research before our podcast, like we always do, there was this lovely little graph that talked about treatment options. And this graph is from 2019. In 2019, 75.4% of medical professionals recommended adult diapers.
For stress urinary
incontinence for women.
Which is the most common form of incontinence, which means you're sneezing, you're jumping on the trampoline.
You're coughing, you're carrying something.
Yeah. And
you pee a little.
Yeah, you pee a little.
Some leakage.
So what do? Wear diapers.
I can't even imagine if I went to my doctor and said, hey, when I jump on the trampoline with my kids, I have a little bit of urination that occurs that I can't control. And he says, wear adult diapers. Or she says, I just can't even imagine that conversation. That's crazy to me.
And I was kind of surprised. So nowhere on here is it really recommending anything regenerative.
No.
But they have catheters.
Yeah, that's
drainage.
The second one.
Yeah.
12% was catheters.
Yes.
Incontinence catheters. That seems insane to me.
And then drainage bags with them. And then artificial sphincter, so some surgical stuff and slings
meshes.
And even sacral nerve stimulating devices. So the bottom line is that we've all heard of slings and meshes, because if you haven't heard them from the doctor or from your friends, you see them on TV because you see the attorneys flashing up, mesh Have
you had pain since you've had mesh?
Yes.
You can sue or whatever.
Yes.
It's
There's
crazy.
lots of that. So, and if you look at FDA approval, those were all FDA approved for surgery because everything that's surgical has to be FDA approved. So if you're looking for FDA approval to be a long-term solution with no issues, well, this is a perfect example of how that isn't the case because meshes were FDA approved and now are causing an issue. So, and then people are having to have them removed. So a second surgery, even complications related to it. Yeah, all kinds of issues. So we want non-surgical options, but options that are regenerative. So basically you're doing something to the tissue to tell it it's injured so it repairs itself. And that's what you want to have done.
And it'll be sustained, right? We don't want to do something that you're turning around and having to redo again immediately. We want sustained results. We want to see functional change.
Yeah. You really want to give the tissue back what it needs to repair. And if that's muscle stimulation, if that's growth factors and increased collagen, if it's increased blood flow, nerve sensitivity, all of that. So you want to regenerate for sustained results. And also, that's the only way that you can really regenerate function. You can't cut or use medications and ever regain function in that way.
So we've talked about stress incontinence. There's a lot of different types of urinary incontinence. Stress incontinence, I think, is probably one of the most common we see. But there is also urge incontinence. So that's that sudden, I gotta go right now.
Always got to feel like you got to go to the bathroom. Or if you do, you got to rush there. And that's the second, the urge. And in most of our treatments, we'll treat both of them. If it's an overflow incontinence, that's a little harder, not a guarantee. And there are some things that what we're using for regeneration are not going to treat. So if you have any, again, overflow or...
So that's when your bladder... So for women out there that hold it constantly, right? We got to pee, but we hold our pee.
Nurses that are working and
we're terrible at it. Nurses, we're terrible. We hold it. So what happens is that bladder stretches. So then when we go to the bathroom, we don't actually fully empty out the bladder. So there's always some urine still there. So that overflow is because we're not fully emptying the bladder. So there is some bladder retraining you can do. And the urologist can always scan and see if that's an issue. If you're retaining, they have you use the restroom. They scan to see how much volume is left over afterwards. So it's an easy relative thing to diagnose and look at. But that's the difference between that overflow versus having to go.
So it's almost like you've untrained your muscles and now they're stretched to the point where they're not working. So that one's a hard one for regeneration. So please go frequently. And then prolapse of any sort. So if you have a urethral prolapse, a cervical prolapse, rectal, anything coming into the vaginal canal causing issues, again, a simple exam will tell us that. So it's really strict. Urinary incontinence from stress or urge, or decreased orgasmic strength, normal exams, normal cervical exams, or, dryness, so that you want increased lubrication. And so those are things we can treat for sure.
Absolutely.
And then all the devices.
And that's why it is so important to go to a clinic that has multiple modalities of treatment. So we have treatments for the external vagina, for the internal, for orgasmic strength, for urinary incontinence, for clitoral sensitivity, you name it. We've got something for everyone. So for us, when our patients come to us, if you're coming in and you're like, my main problem is this, well, we may not need all these other treatments where now we have something that can really just focus on that pelvic floor and incontinence. Now, if we have that and we have decreased orgasmic strength, and we have some decreased lubrication or some laxity, of course, then we have other treatments, or we can do combination of treatments. So we really want to be comprehensive in our treatments always, especially when it comes to vaginal rejuvenation.
Well, and it continues to get better and better over time, meaning that these services and treatments are getting so scientifically advanced. I love it.
Absolutely.
So we started way back with just an Oshot, which is, again, we're drawing your own blood, we're spinning it down, getting the platelets. Platelets have growth factors in them. Then we're re-injecting them into the clitoris. The G-spot sounds like it's painful. It's not. but we can get regeneration of nerves for increased sensitivity, regeneration of blood flow or blood vessels, blood flow, and then lubrication. So that was a start. We would pair that with the laser internally to tighten and to, again, increase orgasmic strength.
And that would be our
blood
Votiva
flow.
laser that we
Votiva.
like.
We actually have 2 of them, but Votiva is the more
More.
common of the 2 that we use. So we'd always do those for paired urinary incontinence, orgasmic changes, laxity, and they worked great.
Wonderful. Yep.
But now if you have resistant, we have Vtone we can offer, or if you have known pelvic floor, or sometimes if you didn't want to, but most of these are going to work in combination. The issue is we get better and better with what we can treat because now we can be more comprehensive, like Faraday said.
Exactly. So one of our new machines that we got is called the Vtone.
And we do really like it a lot.
Absolutely.
So it is something that you can just insert inside and it electrically stimulates the pelvic floor muscles. So it's a little weird feeling. We have both tried it. But
it
again,
is different. It is non-painful.
No,
I want to stress
nothing.
that. It is not painful, but it is a different type of sensation. Like you can do a Kegel and everyone can do that right now. You know exactly what that feels like. It doesn't feel like that. It's like a Kegel on steroids and then some weird feeling.
And you can go from a level of 1 to 50. And so you don't have to go to 50. You can be at 5 and you're still stimulating that muscle. So
Absolutely.
the weaker it is, the lower the level you're going to have it first because it's stimulating it in its weakest spots. And then you get used to it and you're going to acclimate and you're going to increase your energy over time or increase time or sessions. But yeah, it's I say different, not in a bad way because it's working.
Absolutely,
And
because
it's
it
not
likes
painful.
to grab on through the training. The trainer was talking about how it wants to grab our weakest muscle. So it's going to activate the weakest muscles. So these are muscles that we don't always use, right? Or that we're even super aware are there. And that how those can affect our functional anatomy.
Yes.
So it is weird because they're not muscles that I think that I could actually activate on my own outside of a
I think
Kegel.
that's probably why it's such a strange feeling because it is not something
I can't
that
sit
I could
here
do.
and recreate that sensation. So that's why it's weird or different, but it is not painful. It is a quick treatment, relatively quick treatment times, 20 minutes.
It doesn't heat. There's no downtime. It's not painful. It's short in office, and you do a series of them to get. And again, you can do a series for as long as you want, but usually you're doing a series of at least 6 of them.
6.
And that will start the process. And it is, I agree with you, something that you could not reproduce on your own.
No.
And it is FDA approved to reach the pelvic floor. So again, but it's not surgical. It's nothing that you have to take out. So it's just stimulating.
It's non-invasive. It's in office.
Yeah.
It's easy.
There's really no downside to it at all because
You can continue activity that day. You can go work out afterwards. You can go
have
sex afterwards if you wanted to. So it's not ablative. It's not going to be removing layers of tissue. It's not. There's no
heating,
downtime.
Not heating.
Yeah, there's no heat.
It's
so you
just
don't have to worry
stimulating
about
the muscle.
burning or blistering or heating of the area.
Yeah, no. So it is an awesome treatment to supplement what we already had.
Yes.
And we're loving it so far because, again, it isn't something that we had because you didn't have electrical stimulation of the muscle of the pelvic floor. Votiva would get to that, but not the way this does. And so it would heat and actually stimulate, but not an electrical stimulation of that muscle.
Not as strong of a contraction. I think that when it comes to where our lasers like Votiva are phenomenal, and our women love them and we get great results, it's a different result for a patient than Vtone, depending on who that patient is. So a lot of times we may see a woman that's perimenopausal, menopausal, that would benefit maybe more from Votiva, where we have some younger women that have some incontinence issues that would benefit from it, that maybe do not have the laxity. They're pre-childbirth. They don't have that kind of laxity that we would maybe recommend for some women with Votiva, or maybe they don't have that decreased orgasmic strength yet because their hormones are optimized and feeling great. And so they're really wanting to work on that pelvic floor muscle. So this would be a great option for those patients, or in conjunction with Votiva for some of our women that need a little bit of everything.
Well, so when women come in with more advanced urinary incontinence, again, Votiva and Oshot work wonderfully. But if you need more, maybe instead of a second Oshot, now we're adding Vtone. And it's so individualized. And we actually do have another laser machine that is also non-ablative, internal. It's just a robotic. So we couldn't necessarily concentrate just on the anterior wall. You can for G-spot, orgasmic strength. But it still did everything and concentrated. But again, it doesn't electrically stimulate. So it just is complemented with the Vtone treatment. So that's awesome.
And then we have another one that's just external. So working on,
and now two
external ones. That's correct.
I know.
We just keep adding all the things.
I know. There's nothing that can't, there's not an issue that you might not be having that we can't address.
Exactly.
I don't want to always say promise to fix, but pretty much, that's without a surgery, without a nerve injury, there's really no reason why we can't. Of course, we talked about things that couldn't be treated like prolapses, and certain types of incontinence. But other than that, there's no way that regeneration is not going to help you with increased blood flow and sensitivity. And the two external ones are like facelifts for the vagina. And that's what
they can lighten, tighten, and brighten.
Yes. It's amazing, the treatments. And we have a couple different options. We have, one that we can do without a laser and one that we can do with a laser. And both of them are highly effective and great before and afters on a website for you to look at. So,
but back to
Vtone.
You got me off I know. We can go on. If you cannot tell, sexual wellness is a passion.
We can go on forever. Yes.
And we have all the things for vaginal rejuvenation.
Yes. And ladies, they are just like the low T clinics are everywhere for men. And there's a gender bias with that. They are starting to finally catch up when it comes to female sexual wellness, which I love to see.
So Vtone is, like we said, it's easy, painless procedure. It is a device that is inserted into the vaginal canal. It has two little electrodes, top and bottom. It aims for the weakest muscle, and it is a contraction of those muscles. It is EMS. So contractions lead to stronger, tighter muscles, which give patients better control of their bladder. And Dr. Durst actually has one of the devices.
So this is one of the Vtone devices. So this is inserted again into the ledge. And then this is one of the bipolar devices, or not bipolar. This is an EMS stimulator and over there. So it goes into the top by the urethra and then by the rectum, and is stimulating the muscles of the pelvis. So that's as simple as it is right there.
Exactly. And it works extremely well.
Extremely well. And so again, not uncomfortable. It's not big. It's not a speculum. All ladies have had that before.
Oh yeah. Oh no, nothing like that.
Yes. So, but anyhow, and again, no pain, no downtime. You can do anything. Simple in office and a series of treatments.
What is usually recommended is 6 treatments, but again, everybody is so different, and we can customize those treatments. If, like Dr. Durst had kind of hit on, we may be doing Votiva and Oshot, and then maybe instead of doing a package of 6 of the Vtone, we do 3 of our Votivas and Oshot, and we add 3 Vtone in and make a combination to really meet your needs. Or maybe we're doing the 4V, which we've talked about on other podcasts, and Votiva on other podcasts. If you guys are ever interested to hear more about some of these other treatments that we're talking about, we have a ton of podcasts that talk about all of these treatments more specifically as well, that you can always reference back to.
Yes.
And then the 4V is the other one that we could always partner with
I gotta
too.
Get her off the facelift now.
Yeah.
But more importantly, even with the Vtone, is that, again, that contraction of one and done contraction if we're doing it ourselves with Kegels. But with this, contracting to the point of fatigue.
And
so
then
the muscle
past that point.
Yeah, so it contracts way beyond what we can do, and therefore is really strengthening that muscle.
Yeah. So
we can't.
Which helps with that bladder neck.
Yes.
the urethral sphincter, and really trying to support and give that pressure back to help with any of that incontinence.
Yeah. I mean, I love all these treatments together.
Yeah.
Like there's nothing that you can't make better. Again, it just depends whether you're looking at function, orgasmic strength, urinary incontinence, or prettier vagina. We have all the options. So
Absolutely.
yes, Faraday is right. We have lots of podcasts on the different one. And this is actually probably a good one to do live at some point too, just so people can ask questions, not the Vtone, but just in general, all the options that we have. But if you have any questions, experiences with anything that we discuss, then please leave a comment.
Absolutely. If you were ever told to wear adult diapers, I mean, let us know. That blows my mind. It cannot be that high of a percent. I just don't believe it.
I don't believe it.
It seems
either.
crazy.
I don't believe
if you've had experience with mesh or a sling, or if you've done any type of EMS, I don't know of any kind of device other than this that has ever done anything
There is
like that.
one on the outside that we can use, just a tone, where it's a muscle stimulator on the outside, not recommended for treatment of urinary incontinence that's severe, but you can actually kind of do that.
You
from
can target
muscles
that
of
muscle.
Yeah, it targets it down there, but you also do abs at the same time. So that's an option.
Yep. And that one is a Vtone. No,
That's what I was saying. Tone, just tone.
Just tone.
Yeah.
But it does. It
Tone.
sits very low on the abdominal wall, and it will contract those pelvic muscles, but you don't get that internal contraction.
Yeah. And then you also get a little ab workout at the same time.
Yeah.
So if you have questions, if you have experiences you want to share, please do like, subscribe, hit the bell, share with friends. And again, let us know what you want to hear, because we're willing to deep dive into anything wellness, aesthetics, or sexual wellness.